You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with migraine headaches or chronic headaches, jaw pain, just overall head pain. And with us, we have an expert on the topic. He's been on the show before, Dr. Mac Lee. Dr. Lee, welcome to the program.
I am happy to be back, Randy. It's great to be here.
Now, we had you on the program before talking about replacing missing teeth with dental implants.
Right.
You say no more dentures.
That's right.
So now since I've interviewed you, a lot of people see you.
They'll stop me in the grocery store. I'll be in Victoria, Texas, and they stop me at HEB and say, "Oh, I saw you on TV." So yeah, it's been exciting. It's been fun. I love it.
So now, a lot of people, like you say, they didn't know their options.
No, and the denture thing, they didn't know their options, that they could have a denture that snaps in. And in our topic today, people have all this head pain. They have pain in their ears. They go to the ENT. They have pain that radiates all back in here into their neck. They go into the neurologist without any help. And I've been successfully treating these patients for many years now. And it is just absolutely fantastic that the service that it provides these people who have life-robbing pains. I mean, it is a bad deal. They can end up in the ER. They can't go on a camping trip. They can't do these. It's really a devastating thing for them to have in their life, and it affects the family members too. Now
you are what do you call this discipline of dentistry?
Well, that's the problem. It's called TMJ, TMD, and it makes it very, very confusing. But so I'd like to just talk about head pain. I'd like to talk about tension headaches. I'd talk about clogged ears, talk about the jaws popping when they open and close, and you put your hands like this. Go ahead, Randy.
Yeah.
And close. Okay, if you
feel
popping,
it moving.
Well, you feel that moving, but if you feel a pop, well, then you're probably okay. But if you feel a pop and jaw kind of deviates to the side, there's something wrong going up here, and that can translate to problems all over the head.
Now, I told you going into this, I was very skeptical, right? I'm lucky enough, I knock on wood, that I don't have, headaches and things like that. But I saw your videos, and people need to know, it's a real interview. I'm not siding with you, I'm just asking the questions, and I saw your videos.
The testimonials.
And I said, of people saying that they were in pain, young and old people, headaches, chronic pain, interfered with their life and their work, and it was gone. And some of them right there.
Right there, or at least a week later, one woman said she has not taken a Tylenol or an aspirin in a full year, and she just thought that was a miracle. A lot of them go to a neurologist, and the neurologist orders an MRI, and if I were a doctor and ordered an MRI on you, what would you be thinking? That would create a lot of stress, and then they go back to the neurologist has the radiologist read the report. They say, "There's nothing wrong with you, Randy. Here, take these pills." And they just feel like they can't find help.
So let's get this straight. Okay, so the way the teeth come together, how could that cause pain in the head? Let's start there.
Very confusing, and you're absolutely right. Okay.
What's the connection?
Now, if I had one foot that was shorter than the other,
all right,
and I walked, and I didn't have an orthotic to make them even, and I went and walked a couple of miles, what would happen to my muscles in my back and my spine? They would hurt.
Okay.
Correct?
Yeah, makes sense.
So if the lower jaw comes and teeth hit one side and then another, that's not any different than one foot being shorter than the other. Or if the bones in your spine are compressed, then that nerves coming out are going to cause some kind of problem somewhere down in the back, right? I don't know if you ever had back problems or not.
Yeah.
So you know what I'm talking about.
Yeah.
Okay, so the nerves of the brain that take care of all this come right past this joint. So if this joint is compressed, when you do like this and you can feel all this popping, then those nerves...
So there's nerves right here.
They go right down through here like this, yes. And so if the jaws are not correct, then if the jaw wants to close this way, but it has to pull back in order for the back teeth to touch, then everything is pushed forward back into the ears. And you can actually put your finger in your ear and bite down and tap, 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 and feel the joint trying to push your finger out. This is not on everybody, just on the ones that have the problem. then they can bring their jaw forward and tap like this, and then that problem goes
So
away.
somebody watching this at home, okay, you put your pinky in your
Put your
ear.
pinky in your ear, just like this.
Because I did this on the phone with you.
With me, yeah.
And you can feel it moving.
You feel it, and if it starts pushing your ear out and you got a pain there, that to me as a treating dentist is like, oh, I can help this person.
You can fix that.
Yeah, we can't fix this, but we can fix the problems the pain that they're having.
So when we hear TMJ, that stands for
that joint right there, the temporomandibular joint.
Then what's TMD? How is that different?
TMD is temporomandibular joint dysfunction.
So when people come to you, like some of the people in the video, when they have dental advanced wear and tear and on their teeth, it can lead to these headaches or ringing in the ears or congestion or whatever.
Yeah, you bring up a great point. This is things that dentists actually argue about, because you can have bite problems where the teeth don't come together and no pain. And what happens though is it wears all the teeth down. You've seen some of the pictures of these teeth that have been worn down and broken down, but no pain. And then you have people who have this, the bite looks perfectly well, looks good, and they have a horrible pain every day. And they have different people have different kinds of pain. Sometimes they wake up in the middle of the night with pain. Sometimes they wake up in the morning with pain. Sometimes it's in the afternoon after a stressful day.
So you're talking about symptoms. Okay, so
the symptoms,
for
the
people
pain
tuning in,
symptoms.
we're talking about symptoms that you have a TMJ problem. So the symptoms are you wake up a sore jaw.
Yeah, this is where it's confusing.
Okay.
Okay, it's not a TMJ problem as much as it is a muscle problem. The pain that they're feeling is mostly from the muscles.
All right.
If they have a joint pain, it's because that joint is pushed back too forward, which also involves the muscles.
So the symptoms are, popping and clicking.
Popping and clicking, which is everybody knows that's a very easy symptom to realize. And sometimes it's not painful. It's still not right, because it's going to lead to wear and tear over a period of time. And if this is not right, then the teeth are not right when they're hitting together. So then you can have a popping joint with pain, and you saw the video where the woman says, I take my appliance out and I bite down, and that hurts, put my appliance back in. And then you have people that have pain that's just all down up in here. They don't like to wear a hat. They have lots of things that just really bother them. They may be hurting in the back of the neck. But the neat thing is, if somebody comes to me in pain like that, it only takes me a few minutes to palpate a few muscles, to ask a few questions, to be able to say, I can help you.
But you see reversals in these problems every week in your practice?
You can be almost 90% sure, if I go through the proper diagnosis, that I can say, yes, Randy, I can help you with the pain that you came in for. And if you have a pain of 10, I'm sure we could take you down to a 2. Hopefully we could take you down to a 1. But let me ask you, if you had an ER pain where you had to go to the hospital and it was like every other day and a pain of 10, what would you be happy with if I could get it down to?
Just tolerable, I guess.
Tolerable is great, but having it down to a 1 is
And you see that in your practice?
Yes, we see it all the time.
So let's go through the symptoms again. Okay, so if somebody has the obvious popping, clicking, or when they bite, they feel like their teeth aren't coming together properly, and they have like the headaches and things like that.
Yes, all of those.
And worn flat teeth. Like if you have worn teeth, or you've been told you're a grinder, is that another symptom?
Yes, absolutely. And you can look down here and just see, look in the mirror and just see if these teeth have been ground down. That's a real telltale sign. And any kind of wear or breakage, or every time you break a tooth, why did you break a tooth? I mean, especially if the tooth has not been filled. So breakage is a big problem, but I'd like to go back to the pain, because if you just have wear, you look at it and say, well, I'm just getting old, it's no big deal. But if you have any kind of pain, like up in here, okay, so let me give you an example.
All right.
I have a patient that has been wearing one of these orthotics. We call them an orthotic because it makes things even, just like an orthotic that you wear in the shoe. And she had been wearing it for 3 years. And she came in for her hygiene appointment. And I said, how you doing with your appliance? She said, oh, I'm doing good. I'm doing really well. Good. I couldn't live without this thing. I said, well, do you have any headaches? Oh, yeah, sometimes I have, some allergies. I like when? She said, oh, well, I've got a little headache right here from my allergies. So I said, come on. So we adjusted her bite, adjusted her appliance, got it all dialed back in again. And she said, my headache is gone. This is just unbelievable. And when you say, okay, Randy, let me ask you this. What if I were to take your appliance away from you? What would you do? Well, number one, you are not taking this appliance away because I can't do without this thing. That is probably one of the biggest comments that we hear. I cannot do without this appliance.
Like they worry they're going to lose it.
Well, they end up wearing it just at night. So we may go through a period of with them wearing it 24/7 to kind of get things settled because the body is seeking balance. I think that's my biggest message today. The body is seeking balance, and if this jaw-to-jaw relationship is not balanced, and when your teeth don't hit and they're not balanced, there's going to be a problem somewhere.
Okay, you brought some videos.
Yes.
Now, what are we going to see in this first one?
Well, one is this person, and she's, not real young, and all of a sudden she started having a joint that was just killing her. I mean, absolutely killing her. So she calls the oral surgeon.
Like pain that was coming out of the side of her face.
Oh, just all radiating in here. And so she calls the oral surgeon. The oral surgeon in our area refers these patients to me. And so we made her this appliance, and she was just astounded.
So that's what we're going to see.
Yeah, the 1 week later, she had no pain whatsoever. Now, if she takes her appliance out and bites down, and that joint goes back to the bad position, then she had her pain again. She's, I got to put it back in. I got to put it back in.
Okay, good. So let's go to the clip.
In my jaw, I could not open. The grinding, the popping was absolutely awful. It was terrible. I couldn't eat. I couldn't sleep. It was just absolutely terrible. And now that I've got the Guardian, I'm pain-free.
It's been a week.
Yes, we're in the Guard 1 week, and I'm completely pain-free, and I can open my jaw wider, and I can actually eat.
Eat a hamburger.
Without pain. Yes, it's fantastic.
All right, so is that common?
That's very common. But again,
that wasn't scripted. I mean, that looked pretty good.
Yeah, I don't think you're going to script that person. She has a mind of her own, and she did a great job of explaining to other people. But
so how was it the pain went away so fast? I mean, she puts in the appliance.
Right.
And I'm calling it appliance. It kind of just makes the teeth comfortable so the muscles are no longer tense. Is that kind of what?
Okay, so if I take my finger and go and punch it in your back and it hurts, when is it going to stop hurting?
When you pull it away.
When I pull it away. Okay, so if this joint is being pushed back into the ear, because that's the way she has to bite down, making her jaw go back this way, then I make the appliance allowing the jaw to come forward a little bit, and when she bites down, then she's even and she's solid. So now I'm not poking you in the back anymore with my finger. So she takes the appliance out, bites down, and guess what? She's poking you in the back again. So they want that appliance in there. As time goes by, this starts resolving and the body starts healing itself. The body has incredible potential to heal itself. So this starts healing itself, and so she can start weaning herself off daytime wear and then just wear it at night.
Just wear it at night.
And most people who have either this pain or the pain up in here. Okay, so have you ever had a trigger point? You ever had?
Yes, yes.
So you know what a trigger point is?
Yeah.
So when somebody can grab a spot on a muscle and push on it, especially a massage therapist, and you want to go right through the ceiling. Okay, so what happens to these muscles that when they can't operate right, then they recruit other muscles to help them out. So these muscles were not made to do that work. So they go into spasms and you have these trigger points. So you push on a trigger point right here, and guess what? It radiates to this pain right here. So this is all about muscles. And a muscle is just a muscle, whether it's in your leg or your hip or your arm or in your face. So really we're treating muscles. And the way we're treating muscles is by taking that jaw and putting it in the right place, and then when the teeth come down together, they hit even and they're solid and they're balanced.
Now, have you had any success with people with migraines, or at least they're calling them migraines?
Boy, migraines. So that's a very confusing issue also. So people who have tension headaches think they have migraines. And yes, we've helped tons of people who thought that they had migraines. And if they are officially diagnosed with migraines, they have the auras, they have upset, they get, have to be in a dark room. We have found that with this technique, this technology, we've had people who have decreased the amount of pain and decreased the frequency. And that's very important to a person who has these life-robbing things like migraines. And they also are astounded. Everybody that we work on is astounded that this works.
One of the reasons why I wanted to have you on the program, 18 years ago when we started the show, this was considered a dentist taking care of migraine headaches or headache pain or neck pain. And now the medical doctors, I have medical doctors on the program, I told you this, that they send their patients when they say they have these cluster headaches or tension headaches or migraine headaches, and they send them to a qualified dentist that does this.
Yes. And
so it's become mainstream.
Yes, and they're referring to me too also, which is just fantastic. But you bring up a good point, because the public thinks this is a medical problem, when in fact it is a dental problem, and only a dentist is qualified, and as you said, a qualified dentist, one that's been highly trained in this orthopedic dentistry, to be able to help these patients. More and more medical doctors are on board with this because they're starting to understand. They haven't been able to help these patients in the past, and so yeah, they're starting to refer them to us, and they're getting good reports back, so they're happy campers too, because now they're able to help their patients.
Now you brought some photos, because
Yes.
a lot of these, they look like cosmetic dentistry photos, but they came to you a mess with pain. They ended up not only out of pain, but with a great smile. But we're going to talk about this after the break. Okay?
Okay.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I've had headaches all my life, especially stress headaches from my shoulders, go up my neck. And I think the small appliance helped with that some. But when I got this appliance, I've not had one single headache, and I've not taken one aspirin or one Tylenol in the whole year, which is miraculous, I think.
I had severe joint pain in my jaws from when it was time to eat. The appliance that I used for a couple of months and had it working, at the end of the deal, it was working fine, and I had no more joint pain, and I could tell that my teeth were lining up better because there was no more joint pain in my jaws, and other things too. I had the tingling in your ears and the sounds in the ears, the buzzing in your ears. It all went away also.
Yes, when I close my mouth now, it comes down into a position that I don't have any pain in my jaws, and my teeth, lower jaw doesn't slide back like it did prior to making this.
And it keeps that joint off of the back of the ear.
Yes.
Where you're feeling the ear problems, where
Yes.
you went to the doctor about that too, right?
Yes, and I had a pain in my ears that was periodically come, and I thought it was just part of it because it's been there quite a while. And since I've been wearing the bottom, well, actually both of these, mainly the bottom, I have not had that pain in my ears like I did.
You're watching The Wellness Hour. I'm Randy Alvarez. We're discussing eliminating head pain. Could be migraine headaches, cluster headaches, tension headaches, ringing in the ears, maybe some neck pain, a new treatment option, and dentists across the country, highly skilled dentists, are now treating this with this TMJ problem, or TMD problem, as Dr. Mac Lee. Okay, so you brought some photos.
I brought some photos.
And those, by the way, the video testimonials you have,
they're great, aren't they?
Yeah,
and great people.
They could have been better. It's like I'm looking at them. You kind of almost want to laugh. It's like hard to believe.
Some of the dentists said, you paid these people to say this, when I was showing them these testimonials, because they're good, but they really come from the heart, and these people really mean it, and it's very obvious.
Because when I look at those videos, and I asked you in the green room, I said, are there really a lot of people like this?
There's supposed to be, and I don't know the research, but the number one reason people go to an MD is back pain. And then the second reason they go to an MD is because of head pain.
So they go back pain or head pain?
Yes. And so the head pain, they just need to refer them to us. Now, let me show you this patient.
All
I
right.
grew up this guy. Great guy. Now, he didn't not come to me as a pain patient. His wife made him come. His wife made him come because she said, honey, you've taken care of us and the family all these years. Your teeth look horrible. They're all broken down, and you need to take care of yourself. Now, the reason they're broken down, you want to have a guess, take a guess at why they're broken down.
I don't know.
Because they don't fit together. So if you got gears in a car that don't fit together, what is a good
So
gear?
that's just not decay or
That's
gum
not
disease
decay,
or whatever?
that's not gum disease. He has no pain.
So his teeth
But
would
if
come
his
together.
jaws don't come down together correctly, you're going to break something. If the gears in the car don't fit together correctly, you're going to break something, or you're going to wear it down. So all those teeth, the before and afters that you see,
That's a nice smile afterwards.
that's a beautiful smile after. It's a life-changing smile. So you do that afterwards, that all has to be done at the same time. But we have the technology and the knowledge to be able to do that, and we love doing that also. But
This is
person
the guy
was
you
not in
went
pain.
to high school with.
Yeah, went to high school with him. Sure did.
That's a beautiful smile.
he feels good
Now,
about
did
it.
he have any symptoms, like any pain symptoms? But for him, it just was destroying his teeth.
He had popping of the joint, okay, but it was pain. It was not painful for him. He's worked in the oil field. I mean, big up in the oil field stuff. So he's an oil field worker. He's tough. He's a big guy, tough. So he didn't want to take care of himself, but the family wanted to get him taken care of.
And of course, it changes his appearance.
Absolutely. Now he smiles a lot. People that have bad teeth, and I'll show you a case in a minute, they don't even know how to smile anymore. They walk around like this, and they take pictures like this. And when we fix them all up, then they walk into a room and light it up.
Yeah. Well, you have nice teeth.
Thank you, sir.
And I see you on Facebook. You're smiling on Facebook.
Yes, we do smile a lot, and people do notice the teeth. People notice teeth, no doubt about it.
So, the next photo.
Okay, the next one is a little bit different. So everybody's different. This doesn't come in a protocol that everybody's the same. So this guy's, only his front teeth were all worn down. He was a cabinet maker. He was an artist. Okay. And he knew that that wasn't right. And he knew that they were just going to keep wearing and just wear all the way down.
So they're
to the
perfectly flat.
They're perfectly flat
what's
on the
going
lower.
on?
So he's worn off around 60 to 70% of his upper and lower front teeth.
So he's a teeth. You call him a teeth grinder?
He just
So why do some people grind and some people don't? Like, why is he grinding so bad?
If I stick my fingers in the back, it's not comfortable. So they're not in a comfortable position, and they're looking for a more comfortable position by bringing that jaw forward. They're not having head pain. They just know something's not right.
So like so they're not grinding during the day. It's like when they're sleeping?
Sure, they can do it at nighttime, daytime. It just all depends. But when you have that kind of destruction, it's not going to stop.
So when you see flat, worn down teeth, you say this person has a
non-painful TMD or non-painful TMJ. They have a bite issue. Their gears do not fit. There will be trouble down the line. When it's going to happen, I have no idea. Is it going to happen if they live long enough? Yes, it's going to happen.
So what'd you do for him?
So that's his afters. We crowned every single tooth in his head and put his jaw-to-jaw relationship back together again. We did that probably about 7 or 8 years ago. Hadn't had any problems whatsoever, no breakage. He's doing wonderful. And because he's an artist, he cannot get over the precision and the preciseness of the work and what we were able to do. This one was the most exciting case that I've ever done.
All right. Oh my
This guy had worn down his upper front teeth down to the gum line. And he did not want dentures. He was very adamant about not wanting dentures. A hard worker, grind. And I was able to do some surgical techniques to crown each and every one of his teeth. He got to keep each and every one of his teeth, and now he's got that smile. And if you look at that smile, you can see that it's a little bit, he doesn't really know what to do because he probably hadn't smiled in 30 or 40 years. And so it's a life-changing event. And he was non-painful. Okay, I brought a slide that kind of sums everything up.
All right, let's go to the slide.
So you can see that this man's 1 foot is shorter than the other, and he has to wear a specially made orthotic for his shoe. Now, this man has been going to his doctor for years complaining of ear problems. Years. Saying, what can you do? What can you do? Send him to ENT. Nothing's wrong, nothing's wrong, nothing's wrong. He comes to me, and we make him one of these orthotics that relieves this joint away from this pain. Guess what?
His earaches go away.
Immediately.
Really?
Now, that's been 5 years. They're still gone. So this works.
Tell us about how you say people come in and they always have an excuse why they're having headaches or why they're having pain. Tell me about that.
So people get so confused, and they want a reason that they're in pain. Oh, I got allergies, I got this, I got that, I was in a wreck, I have all these kind of problems. And we finally learned to interview the patient. I would say, now, Randy, do you have headaches? It is a yes or no question. Because if I say, Randy, you have headaches? Well, maybe sometimes. And the family's saying, yes, he has headaches all the time. So, Randy, it's a yes or no question. Do you have headaches?
So yes, I don't. But so when the patient says yes.
Yes, because they get so confused. There's so many different things. You've got Tylenol, you've got Advil, you've got all these medications to help people with head pain. All it is a trigger point. All it is a spasm, a muscle that's in spasm. And we can take care of that. So there's a lot of confusion there. And I'd like for this documentary to help clear up that confusion.
Medical doctors will watch this show.
Yes.
And they need to know that, that this is kind of a movement. I mean, they probably know of it, but maybe they don't know that you treat.
They know of it. They just don't know the symptoms of it. I'm speaking to the physicians. I spoke to our local hospital about this. They're all like, wow, we had no idea. So physicians are taught, it's not their fault. They're taught nothing about dentistry, nothing about dental health, nothing about TMJ in medical school. They don't have any continuing education courses on, because it's not their field. It's not their field of specialty. It's ours.
But you are seeing people that had the ear pain, ringing in the ear,
Yes.
jaw pain, clicking,
Yes.
migraines,
Yes.
that it goes away.
Yes.
For somebody watching this and they are still skeptical, tell me about that first consultation.
The first consultation is we just sit down and talk.
Okay.
And I want to find out what your symptoms are. I want to look in your mouth. I want to palpate some muscles. I want to just have a general look and have a general discussion. There's no pain, there's no shots, there's nothing like any dental visit that you've ever had. And that's all we have to do. And then I can tell the patient whether I can help them or whether I can't help them.
How soon? You've been doing this a while. Can you look at their mouth, look at the muscles on their face, and in your mind go, this is going to be good?
Yes.
Really?
Yes, absolutely. I think you witnessed it with one of your team members today.
Now, we should mention Medicare, Medicaid does not cover this at all.
No.
And also insure, even the best insurance.
But we've got third-party payments. So if people got credit, we've got arranged with these other companies that they can get finance it just like they would for a vehicle.
Do people finance these
Sure.
procedures?
Yes, absolutely. Absolutely. No, we don't do it, but we have outside companies that do it. That's their job.
So you arrange it for them?
We arrange it for them and help them get it. Yes, absolutely.
Okay, so final message. Somebody watching this, they've got migraines, headaches. They've been told they grind their teeth and they have unexplained facial pain.
Please just call me. Just call me and get an appointment. Talk to the team. Ask them questions. Get in touch with us. It won't take long. And it's just, you'll have a great experience. That's just one thing that I promise. And you will have your eyes opened on some of the possibilities that you never knew that you had.
Not a lot of guys where you are that do this?
No. No, I'm about the only one.
So you believe there's probably tens of thousands of people within an hour of your practice that are suffering that don't have to be?
Yes. I totally 100% believe that, and I would love to be able to help.
Okay, good. Dr. Lee, always a pleasure to have you on the show.
Thanks again. Sir. Always good to be here.
You watch The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.